Okay, hello everybody. 同学晚安. Today's my lecture or topic will be the English conversation in oral and maxillofacial surgery. I'm Dr. Chi. Okay. The content though coming from the textbook of the dental terminology. You know the Shu website here. Okay, so for the vocabulary and conversation in English, the most important thing is for the English vocabulary and for the pronunciation. So I try to slow down my voice to say something to let you guys can understand what we are talking each other between the doctor, the patient, and the nurses, and you guys, the oral hygienists. Okay. So we are dentists, so we start doing studying dentistry. So dentistry, looking at that. And sometimes if we say the spell, the phonetics will have the capital, they will be with praise in advance. For example, exodontia, okay? So you can see different. You can see the phonetic words, you can know how to pronunciation correctly. So in the part of the dentistry, we are belong to the specialist surgery of oral and the maxillofacial surgery. And so today, in this area, we have the several categories for our vocabulary, such as the instrument, the procedure, for example, the exodontia, odontectomy. Usually the press pronounced will be at the last two, okay. And also the procedure about the soft tissue or surgery, minor surgery, or the minor bone surgery, or surgical procedure about the bone fracture repair, and also the maxillofacial surgery, the major surgery. And also the surgery procedure involves the teeth temperament and the joint dysfunction, and also procedure about the dental implantology, and also the rule in aesthetic dentistry. Okay. You see, a dentist will stand in front of the mouth, usually to see the teeth, to see the cheek, and see the tongue, and see through your throat. You can see them. You can see them. Okay. And we are the oral and maxillofacial surgeon, so we are specialists in Taiwan, and also we have the focus on the face, the jawbone, the mandible, maxilla, and the sinus, face, neck, something like that. So we are the oral and the maxillofacial surgeon. Then let's do some brief reviews of the previously. For example, the first chapter in the week 6. For example, the apicoectomy, the autogenous, or the cellulitis, or concussion. Curettage is a noun, okay, not doing, not a verb. If a verb is curating or curate, for the noun 名词 is a curettage. Assist the hemisection or the hyperextension, hypersensitivity, or implantation, or mobility, necrotic, osteomyelitis of the bone, percussion, perpendicular, pulpectomy, pulpotomy, putrefaction of the pulp tissue. It can die of decomposition.
大家好，我是癌症中心主任邱忠杰医师。癌症是国人10大死因的头号凶手，预防胜于治疗。早期发现、早期治疗是预防癌症的最高准则。定期接受癌症筛检，可有效降低癌症死亡率及改善癌症的治愈率。呼吁民众关心自己及家人的健康，定期接受癌症筛检，才能达到早期发现、早期治疗的目的。万方医院关心您。
So let's see the instrumentation. Okay, you can see it's got first the forceps, the scalpel and scalpel handle, bonfire, curate. Is a noun verb or just the instrument for curettage. Okay, so the forceps. We have four kind of forceps for the upper teeth or lower teeth. They're not shown here with a different beak, beak from a different direction. Okay, for the position of the teeth in the mouth. The scalpel with a several kind of size with a different shape, and then they have the handle attached to that. So that's the scalpel. That's the scalpel handle. We're using that one to attach the scalpel and doing the cutting on the skin on the mucosa. Okay, and there's a bonfire to brushing, to smoothing the bone, and also the curate to do with the like spoon to carving or digging something. Okay, and there's some mallet. We have this one and a pair with the bone chisel. Chisel is looking like that too. Something like that. Okay, the hammer spade, as is or also we say that a mosquito with the curved or straight to biting something or biting your, eating your, drinking your blood, mosquito. And the scissor. We have several kind of scissors to cutting the t-shirt or cutting the suture. Shape. Okay, it's a rounder for biting the bone. Rounder forceps. Okay, and the elevator for elevator, the same elevator with curve for the loot. So it's a loot elevator or the smaller one, loot tip elevator. Okay, and for that one is a para-austere elevator. We show that the PE, para-austere elevator. We're cutting with the scalpel, the mucosa, and using that one PE, para-austere elevator to elevate refraction mucosa. Okay, 把 mucosa 切开翻起来的那个东西 para-austere elevator. And the special kind of the bigger is mean it has a name from the doctor who developed it. It's a Selden para-austere elevator. Okay. So we're just done here, and after tea break we go down further. Okay. After the break, now we start from the minor surgery for remove of the teeth. Okay, exodontia. Odont means the teeth. So putting the teeth outside the socket. So it's exodontia. Okay.
or the better name will be using as odontectomy. Odontectomy. So I mean the odontal teeth. Tectomy. Any kind of word following with the tectomy, it means the cut, remove, take it out, something like that. Okay, odontectomy, exodontia. For example, the wisdom teeth surgery, we have several kind of situation of the teeth. This is the second molar, the third molar of the patient. For the patient, for example, is left side lower posterior teeth, second and third molar. Okay, and so if for one tooth removal for the single extraction, it means once remove one tooth at a time. So we have the simple extraction, just take it out by the forceps or by elevator, or with the thermolar impaction here, impacted teeth, looking like that. So with the several kind of situation, then, for example, horizontal impaction, or vertical impaction, or distal angle, or mesial angulation, angular impaction. For the teeth alignment from the mouth, the second and third molar, for the anterior to that, they will be in the medial side. For the posterior of the teeth, we can say it's the distal side. So the medial and the distal. Okay, 前方的 medial, 后方的 distal or posterior. So it means for looking like that is the C, this one, distal angulation. Angular is the angle with an angle. So distally angulated impaction. For that one is mesial, distal mesial. The head toward the mesial, so mesial angulated impaction. 4 kind of impaction. And fifth one is looking like that. A transverse impaction. You can see the crown is here and root is there. So they are horizontally like that, not horizontal like the anterior posterior. They are transversely looking like that. So it's a transverse impaction from the right side to left side of the patient, or left side to right side of the patient. Look like that. Okay, the teeth will looking like this way, head and tail. Okay, and if we remove the multiple teeth, more than 2, more than 1, at one time. So, for example, remove that one, 3 teeth here, and the socket, and with the available of the socket with the bridge over here. Usually we will remove part of the available crest. That's one, this one, this one. So that means aviolectomy, or for the better healing about the wound, because several teeth together. For it, in one case, if the patient has many teeth, all of the teeth, remaining teeth on the mouth are bad, need to remove at once. So I mean the full mouth extraction. So after remove the many teeth, so sometimes with a guided surgical template, a pattern of by the acrylic resin, looking at that. After remove the teeth, putting the template here to guide us how to perform the aviolectomy for a better shape. Furthermore, for the following the denture fabrication. 方便之后做活动假牙 denture fabrication. Okay. So after the odontectomy, tooth extraction, sometimes maybe with a problem. For example, the inflammation in the socket, so it means alveolitis. The patient will feeling the painful around the wound in the socket and need a longer time to healing, maybe 2 or 3 weeks. And the other situation is dry socket. Socket is dry, looking like this. 3 days or 5 days after the odontectomy, the patient is still painful, and we do not find anything inside the socket, even a blood clot or healing the gingiva or soft tissue growing in. No, nothing inside. So I mean the dry in the socket is very painful. It's a kind of situation. Okay. And then for the minor oral surgery in soft tissue, 软组织肉 usually is a mucosa, doing the surgery to the mucosa of the gingiva around the teeth. Okay, so that means cut that one, gingivectomy, or just shaping the shape, molding the shape. It's just a gingivoplasty, gingivectomy, gingivoplasty. Plasty it means to molding shape, 整形哦，整理它的形状，整形。The vectomectomy is just remove, cut that one. So looking at the diagram like that, gingivectomy, we cut using the scalpel to remove whole the gingival papilla for the periodontitis treatment. Or if just shaping that one, cutting part of that, remains the other one, so that the gingivoplasty. And also for the pericoronitis, something like this. First, second, and third molar is a mesial angulated impaction, and we sometimes with gingiva will growing over the tooth with the food debris, 食物残渣, and growing the bacteria around here, 长细菌了, so the patient will be painful about the teeth, wisdom teeth. So that's been the pericoronitis, around coral, the crown of the tooth, pericoronitis. Any kind of the titis is mean the kind of inflammation or infection, looking like that, swelling, painful, and sometimes bleeding. So the periodontal flap surgery is for cutting that one for the pericoronitis. 长智齿最常见的问题就在这儿。那 usually the teeth should be removed to resolve the problem. Okay, and if the teeth, the impaction of the pericoronitis doesn't treat it in time, and the bacteria growing very much, and spreading all around here. For example, this is the mouth, the lips, and the chin, and the angle around here, mandible angle around here. Sometimes will swelling bigger inside mouth or on the neck. So with abscess growing from the bacteria to here, 脓肿, 化脓, cellulitis or 蜂窝性组织炎. So we need to incisional and the drainage, I and D, for the odontogenic infection around here or even from here, cut on the neck to remove the abscess, drain from that, 把脓从那边引流放出来. So that's the incision and the drainage, let it come out. Okay. I and D is usually for the most severe chest infection around here. And okay, if sometimes the mucosa or skin surface with some lesion, a kind of tumor growing there, looking at that, you see that there's a little bit ugly, looking very beautiful. So we need to take in some sample specimen from them to send for the pathologic examination. So Dr. Lin Yonghe 老师 will tell us what is that with a diagnosis. If bigger tumor, we can cut in the part of them. So that's mean the incisional biopsy. Incisional biopsy. Okay, part of the lesion. If it's not too big, we just cut at once totally. So that means the excisional biopsy. Incisional biopsy and the incisional biopsy. Usually we're using this one or this one. Both are okay. But in daily practice, usually we say incisional or excisional biopsy. Okay, this is a lesion from the oral mucosa. So the oral mucosa lesion, sometimes most majority belong to the benign lesion. Benign lesion. That means not malignant. What is malignant? Malignant tumor is a kind of cancer. Okay, cancer we can know that's a 癌细胞，癌症的肿瘤。But if not cancerous lesion, not malignant, we say that's the benign, 良性的肿瘤 tumors. For example, granuloma. Granuloma is a kind of infection where bacteria grow inside and swelling and grow out. It's some kind of the easy breathing lesion. It's a kind of granuloma. Or if for longer time with a scarring, with some kind of fibrotic collagen fiber growing around inside the mucosa, maybe become a fibroma. Any kind of oma is meaning tumor, and with something as a tumor, so we can with a name right here. Granulation tissue become a tumor, it's a granuloma. 肉芽组织. If the fibro tissue is a tumor, it's a fibroma. So that's the 纤维组织的瘤 fibroma. If that in Latin is a leuco. Leuco is white 白色. So leukoplakia. That means the 白色的斑痕 白斑 leukoplakia. So if erythroplakia is a kind of name for red, so 红斑. Papilloma or hemangioma with growing a lot of the 血管 blood vessel here. Okay, for example, for the cancer cell, malignant tumor, with the most we can find is squamous cell carcinoma. 鳞状上皮细胞癌 SCC. Okay. That's even epithelium over here is a normal epithelium is a squamous cell, but it becomes tumor cancer, so carcinoma. Carcinoma is a cancer-like the tumor, so carcinoma. 癌症癌细胞 we can say malignant, we can say cancer. When occur precisely we can talk about carcinoma and the epithelium, so SCC. Or some kind we can under the mucosa we can find something black, so it's a melanoma. Melanoma is a kind of cancer. Melanoma. Okay, so for the bone, minor bone surgery we can do in the osteoplasty. Plasty is a shaping. Osteo is bone. So osteoplasty, and also, okay, we'll keep going. And also alveolectomy is available to remove that one. Ectomy, cut the alveolar bone after the tooth removal. And how to cutting the bone? We're cutting bone for what? For the other reason is for the exostosis. Exostosis is a bone outgrowing, for example, here. Okay, and for the spatial position on the palate, we can say that is a kind of torus palatinus here on the palate. And also, if on the mandible liquid surface of the torus, we can say torus mandibulus. Okay. Torus and exostosis. If we found a cyst here inside the bone, for example, with the teeth with problem with caries here, the bacteria, the caries. The bacterial 细菌 will go through here, through the root canal system to here and reach the end of the tooth and then outside, go into the bone and keep going. If keep growing, it will destroy the part of the bone, become the round shape, spherical shape of the bony cavity inside here, above the root apex. So we can say this is a kind of the cyst. Okay, cyst, 囊肿. The cyst is abnormally and crossword like a sac with some fluid present here inside the bone. 一袋子装了水的囊肿. For example, radicular cyst. Radicular cyst is as I said, this is a kind of radicular cyst because they are close related with the root tip. Radicular is the root. So radicular cyst is right here. If in the other situation we have the impacted teeth and with the cyst around the crown of the teeth, so that means the dentigerous cyst. Dentigerous cyst. The dental with the cyst around a teeth on the crown portion is dentigerous. But if on the reticular side, so that's in the reticular cyst. Okay. How to deal with the treatment of the cyst? We can doing the two kind of method. One is for the cyst. The first one is for the cyst enucleation. That means use the sponge going to dig it out at once. In total. But if it's too big, for example, that is the teeth on the maxillary sinus with the ridiculous very big like that. This is just a smaller one. It's the big one like that. So if we cannot just remove totally, it will destruction a lot of the bone tissue, causing the problem. So we can making a hole for the decompression, cutting that one as a hole. So that the water drainage, the fluid will go through here, drainage to the mouth. And for longer time, the cyst will gradually shrinkage. So that's the decompression. We causing the pressure inside, remove the pressure, so it's the decompression. 减除它的压力，让 cyst 不再有水分，让它流出，那这个 cyst 就开始缩小，而不会一直长大。Okay. This is my patient when I will work in the Taiwan Medical Mission in the Switzerland, Southern Africa. So the Mr. Mabusa, I think he just born on the December maybe. So his name, first name is December. So Mr. December got an injury by a traffic accident. So he was hit by car when he walking beside the road at night. So you can see the swelling on the face and also the bone broken on this way and also on the maxilla. So we're doing the treatment to open the wound, open the mucosa to see the bone and to re-align the bone as the original place and doing the fixation by the wire, 铁丝, between the teeth and between the bone. We drilling the hole, putting the wire together and making a chain of the bone segment to like the alignment and the fixation wire and waiting for healing. Usually will be 3 months. You will be okay again. So that means for bone repair is a kind of reduction, reduce the displace the bone back to the original place. 把骨头跑位置的放回去. Okay, reduction. So if we cutting the mucosa going to the bone to see the bone, that means the open surgery for fracture reduction. If just manipulate the bone or just use the wire to tie the teeth upper and teeth, lower teeth together, like this, and cannot open mouth for 3 months. That means the closed type the fracture reduction. 打开骨折处去做重建跟归位，那这个是不打开，直接扳一扳、瞧一瞧它的骨头，然后绑起牙齿去做固定，让它愈合。To cut the fracture reduction. Okay, and now the big one surgery, major surgery for the maxillofacial. For example, the head and neck cancer, the squamous cell carcinoma. So, what? A moment. The computer say he want to go to sleep now. I say negative. We keep going. 有人打瞌睡了，电脑打瞌睡了。好，再来。And good, okay. The December, okay. Now we go to the oral cancer. A brief summary is the oral varicose hyperplasia. Oral varicose hyperplasia is a kind of benign lesion in the oral mucosa, but he is preceding for the cancer, so that means a pre-malignant oral mucosa lesion. So that means if we don't treat this one in early, he will become malignant, become cancer in the future. Okay, right. And also, this kind, the varicose hyperplasia, sometimes will become transformed into the varicose carcinoma. Okay, carcinoma, cancer. And also can become the other kind, the squamous cell carcinoma. Squamous cell carcinoma. Okay. That's the cancer. What's the cancer causing from? From it's inside oral cavity, and usually it's caused by the bad habit. Because, for example, bitter chewing, 槟榔, or cigarette smoking, 抽烟, 吸烟, or alcohol drinking. You can see the number here. The number is the odds ratio. The odds ratio for example, if a normal patient got the oral cancer, the possibility, the risk is belong to 1, not possibility. The risk is 1. Oh. But for patient using bitter nut, it will be 20 or almost 30 times of the risk to get the oral cancer. For cigarette, not too much, just only 20 times the risk. And for alcohol drinking, 10 times the risk. For if we do not any of that one, just only 1 of the risk for getting oral cancer in our lifetime. So that's so the 3 kind of habit is risky because they were possibly causing the oral cancer. And oral cancer in Taiwan is very seriously. For example, for each year we have 7,400 people with a new diagnosis of oral cancer, and usually half of them will be die for each year. So that means a big problem. So this is why this gentleman, after the surgery of the oral cancer, he will stand out in the front to say to everybody, 卖個薄檳榔啊, do not just quit the bitter nut, because your life, your time will killed by the cancer. For your family, you need to quit the bitter nut as soon as possible. Okay, so we're doing the surgery treatment for the oral cancer patient. For example, we remove part of that one, remove the mandible because of the gingival cancer, and doing the tracheostomy for trachea here for surgery, and also cutting the lymphatic system on the neck. Okay, After that one, usually patient will need to radiotherapy 放射治疗 or systemic therapy, for example, chemotherapy, 化学治疗，癌症化学治疗 or targeted therapy, 癌症的标靶治疗。We're afraid about the metastasis of the cancer from the primary side go to the rest of the body part. 癌症最怕的就是转移，从口腔癌转移到脖子、淋巴结，再进一步转移到身上 ，to the liver, to the bone or lung. 癌症口腔癌最容易转移到的是肺部、肝脏跟骨头。OK. So after surgery, encourage the patient to treat and correction their lifestyle to avoid the other cancer occur. And also surgery for cutting that with reconstruction is a case looking like that. The cancer around here in the lower lip, the Mr. Fun. And but the cancer is deep in going to the bone. So the whole size will remove a total. And for the repair the defect, the 缺损的地方 bone and the tissue and the face and the lip, we using the cut, using the side, their 大腿, the skin and muscle and the tissue with the blood vessel 血管 take out and go to here for repair. After the surgery, the Dr. Wu is a Dr. Tang. After surgery together, this is the new face, new chin, new skin from the side, 从大腿来的 and put in here. Because the tumor was cut by me. Okay, it's still with the upper lip and without the lower lips. So that's mean kind of reconstruction, 重建，切除以后要重建 with free flap. It's free, the tissue from the other side can go to this side without any connection. Okay, that's mean a free flap. Just look like the flap, the 组织, the tissue was free fly to from the side to here by microsurgery team here. It's a big microscope for surgery, and looking from here to inside can see the vessel to be connect together. Okay, and for the other maxillofacial surgery, you can do in the alveolar ridge augmentation. For example, after remove the teeth, after healing, the bone will shrinkage is like that, very narrow, and for the alveolar bone, the ridge augmentation, we put in something there to let it grow in a new bone here, and finally the dental implantation can do here. And also we have the surgery, for example, the orthodontic surgery, orthodontic surgery to correction the nasal shape, 正颚手术, let the patient become more better looking. For example, the one kind of orthodontic surgery is genioplasty. Here, genia is the bone name of the chin. For plasty to shaping the modify the shape, so it's a genioplasty. And also, if we have patient with cleft lip or cleft palate like that, we need to repair them. Okay, then we're talking about a TM joint disorder, temporal mandibular joint dysfunction or painful TM joint. This is we're doing the diagnosing with the imaging. It's MRI, magnetic resonance imaging, MR imaging, magnetic resonance imaging, 磁振造影. Okay, 磁振造影 for the ramus, the TM joint condyle and condyle head is a coronal process. The whole ramus of the mandible. We can see in the MR image, we can see the condyle neck and the condyle head here. Okay, 关节头. And then we can see the structure, for example, the condyle disc, TM joint disc around here. the cartilage 软骨 between the bone and the bone for movement, the joint. Okay. The MR image we can see the detail. Is there any problem? If problem on the disc, we can do in the kind of treatment. For example, arthroscope, 因为呢关节镜。Microscope is 显微镜。Okay, the scope is the kind of the instrument to see. So it's arthroscope. We can see through, going to see the 关节结构 arthroscope. So arthroscope obtain joint can doing with the scope, the camera into with the instrument going to the side, penetration time to cleaning. Well, okay. Also can do in an arthroplasty, or arthrotomy to cutting the joint. Okay. For the after the bone grafting, so for the dental implantology, 牙科的人工植牙。So in the implant, we need to also integration to let the bone and the implant teeth binding together. So that means osseous integration. 骨头是整合在一起的，和人工牙根整合在一起。Okay. Now this implant is endosseal implant. It means the endodontic endo, something inside, so inside the bone. So place the implant inside the bone, the endosseal implant. It becomes the pure titanium in the material, 纯钛的金属的 dental implant. It's very biocompatible and with high strength. 有强度，也很跟骨头也很喜欢它，所以它们会种进去会长在一起。So it's biocompatible. 生物相容性很高 ，biocompatible. And then after healing for 3 months, for example in mandible, 愈合了3周之后呢 then the fixture, about the fixture we can put in the abutment here. So to what? To making a new crown here. It's a fixed partial denture. Denture means the crown. So we're making a crown here. Surgery doing for implant, and then with abutment between, and then finally with a crown here, artificial crown here. So it's a whole piece, whole structure of the dental implant. Okay. Alright, in aesthetic dentistry, repair the cavity. Okay. Or also for cosmetic alteration, doing something on the teeth to let it better, more beautiful. It's cosmetic. So for example, making a new fixed partial denture, 重新做门牙的新的假牙去改正颜色或外形的美观 or doing more. Blepharoplasty means for eye, surgery around the eye. 割双眼皮、开眼头、切眼角、打眼袋，这些都叫做 blepharoplasty. Okay. Or rhinoplasty. Rhino is mean the rhinoceros. Rhino is mean 犀牛 rhino 鼻子。So in rhinoplasty is for the nose plastic surgery. 整形整鼻、鼻梁、鼻头、鼻孔、人中等等。Okay. Or maybe Botox. 注射玻尿酸，注射肉毒杆菌 Botox to change the face muscle tone. Okay. Finally, we're talking about holistic cancer care. Holistic is mean the whole people, whole human. We're talking about for cancer patient, we not just treating the patient for their body to cut the tumor or repair, and also we need to care about the spiritual, emotional, and social relationship. 全人的照顾 holistic need to 顾及身体、心理、心灵、社会、身心、社会、灵性4个层面 is holistic. So we can put in the parts are more complete. For the cancer patient, what is holistic the care means? That means in a one diagram. This is a patient, cancer patient with a cancer here. We are doctor, we care about them. We have a good relationship between. 我们有很好的治疗的关系，因为病人信赖我们。So we have compassion to them. We have a direct connection between our 灵性的部分。我们会有同情心、同理心 ，and the patient will feel and trust us. 他相信我们。Then we doing the surgery, but physically to cutting the tumor. 我们在身体的部分做手术、做治疗、照顾他。And also we can care about 以心灵的成分、灵性的成分，还有顾及到这个 patient 跟他的家人关系的一起来照顾他。And all together we have better care about the patient to recovery from the cancer. Okay, 这是全人照顾。This is a scenario of that one. The 80岁 80 years old grandfather, he got oral cancer here. He suffered from that and escaped for 2 years. And finally, the tumor become bigger. So this is a kind of, before the surgery, we raising a family meeting to explanation the whole detail, to persuade, to let the patient to say agree, to say yes, to take the surgery to save his life. So it's a grandfather. She is the wife of the grandfather. And for their son, they have the one son just in United States, working there for a longer time. So we see through the teleconsultation, 用电脑，用远距的视讯 we're talking all together about the cancer suffering from the grandfather. And this is not me. I'm here, so I cannot see myself. And he is a specialist for the spiritual care. 他是灵性关怀師。So 整个展场当中，我们大家就一起，我们两人负责去 tell the story to them, to reanalyze what's the situation and what's problem to let him doesn't want to be surgery for 2 years. 2年以来，他爷爷都一直不愿意做手术。我们就请家人一起来讨论谈谈，他到底他担心是什么事？这就是全人照顾。Okay, so finally we finished today's lecture, and please using the QR code, or you can using that short URL here, from here to here. Alright, you have 7 for what? For this version of the dental terminology textbook. Today our topic in chapter 14, oral surgery. Okay. So we finished today's lecture, and happily and hopefully to see you online in the future. Thank you very much.